Most of us have heard of morning sickness. It's almost this expected, even not so fun part of pregnancy, but what happens when it's not just morning sickness? What if it's so severe that it actually lands you in the hospital? Well, that's what we're diving in today, a condition called Hyperemesis Gravidarum, or HG for short. And let me tell you, it is a whole different world.
Okay, so it's absolutely crucial to get this distinction right from the get-go. On one side, you have typical morning sickness. Yeah, it's uncomfortable, you feel nauseous, but it's generally something you can manage at home. But on the other side, that's Hyperemesis Gravidarum. And we are not just talking about a tougher pregnancy. This is a serious medical condition that often needs serious medical intervention. We're talking hospitalization and intensive care.
So where's the line? At what point does that persistent nausea and vomiting cross over into an actual clinical diagnosis? Let's break down the official definition and really understand what sets this severe condition so far apart from the more common experience.
And this definition is everything, because it's not just about how sick you feel, it's about real, measurable physical harm. The diagnosis of HG really hinges on that severe, relentless vomiting that directly causes some pretty dangerous outcomes. We're talking dehydration, significant weight loss, and major electrolyte imbalances. These aren't just symptoms, they're serious health risks that often mean a hospital stay is unavoidable.
Okay, so we've got the clinical definition down, but what does this actually look like in real life? What are the specific signs and symptoms that doctors are on the lookout for when they suspect someone has Hyperemesis Gravidarum?
The first major red flag, believe it or not, is a number. If a pregnant person loses more than 5% of their pre-pregnancy body weight, that is a massive warning sign. And we're not talking about losing a few pounds because your appetite is off. No, this is substantial weight loss during a time when your body is supposed to be gaining weight. It's a huge signal that something is seriously wrong.
And it's just this relentless, brutal combination of things. The nausea is constant and severe, which leads to vomiting so often that it becomes literally impossible to keep any food or liquid down. And that kicks off this dangerous spiral into dehydration. That, in turn, puts this incredible strain on your whole body. Your heart starts racing, and it all leads to this state of just debilitating fatigue. Your body is just running on empty.
And if it's not treated, the consequences can be, well, they can be really bad. All that vomiting can throw the body's electrolytes completely out of whack, which affects everything from your heart to your muscles, and in some rare, really scary cases, it can even cause serious neurological damage like Wernicke encephalopathy, which is a brain condition that happens from a severe lack of vitamin B1, something your brain absolutely needs to function. So this all brings up a really important question. What in the world is happening in the body to cause such an extreme reaction to pregnancy? Let's get into the science of it and unpack the biological factors that we think are driving this condition.
So, while the exact cause isn't 100% pinned down, scientists have some really strong leads. A huge factor is that massive spike in pregnancy hormones, like HCG and estrogen. Genetics definitely play a part too, with research pointing to a specific protein called GDF15. We also know for sure that the risk goes up if you're carrying twins or triplets, or if you've had HG in a previous pregnancy. All of this just confirms this is a physical, biological condition. It is not psychological.
So, given how incredibly serious this condition can be, the medical response has to be just as serious. How do doctors and nurses fight back against HG to support their patients? Let's take a look at the established treatment protocols. The treatment is really a step-by-step, escalating approach to get the patient stable. The number one priority always is step 1, get IV fluids in to fight that life-threatening dehydration. Once that's happening, you move to step 2, give medications, antiemetics, to try and stop the vomiting. From there, it's on to step 3, replacing any lost electrolytes to get the body back in balance. And finally, in the most severe cases, step 4 is to get nutrition into the body directly, sometimes with a feeding tube or IV nutrition.
Phew! Okay, we have covered a lot. The definition, the symptoms, the causes, the treatments. So now, let's bring it all together and boil this down to the most important takeaways that you should really remember.
And to make this super practical, let's think about the moment this condition might become an actual emergency. What are the signs that mean you need to get immediate medical help? And what's going to happen when that help arrives? Okay, so listen up. This is important. If you or someone you love is going through this, knowing when to get help is key. If you're seeing signs of severe dehydration, like a heart that's racing or feeling so dizzy you can't stand up, it's time to get emergency care.
When paramedics arrive, they're going to assess the situation, probably start an IV right away to give you fluids, and then get you to the hospital. Seriously, don't wait if the symptoms get this bad.
So if you're going to take away just one single idea from all of this, let it be this right here. It's a really clear cause and effects chain that relentless vomiting during pregnancy leads to the dangerous combination of dehydration and weight loss. And that, in turn, often requires serious medical help like IV fluids and a hospital stay. That simple progression, that's what makes HG so different and so incredibly serious.
You know, in the end, just understanding the clinical side of HG is really only the first step. It leads us to a much bigger, much more human question. Now that we know what this is, how can we, as a community, as patients, as healthcare providers, as loved ones, do a better job of supporting people going through these severe and often lonely conditions? What can we do to make sure that everyone gets the compassion and the care they so desperately need?